Hi everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Today our topic is what is back pain. Now I show you how to do Mackenzie neck pain exercise. Mackenzie neck exercise. Did you practice it yesterday? How did you feel? If you feel better, please let me know down below that Mackenzie neck exercise actually help you. Now, if you're an acupuncturist, right, remember when you show to your patient this exercise and tell them that when they move to one position, if there's pain, stop. If there is no pain, keep going, right? Keep going. If there's pain, stop. Don't go any further, right? This is important. This is very, very, very important, right? Now, in back pain, in back pain exercise, I'm going to show you a lot of other exercises as well, that including Mackenzie back exercise. Now, I'm pretty confused, but I'm thinking, how could I show you the exercise in my little office? I'm still thinking about it. But anyway, today it's a new topic. So on the following weeks and days, we're gonna talk about back pain, all about back pain. Now, and today, hi Gab, how are you? And today, we're gonna focus on. Oh, hang on, I think I got it wrong. I signed in the wrong account on Instagram. I need to change it. Should be other account. I'll give you a time. So in the next few days or coming up a week, every day with all topic related to back pain. Now I'm gonna go slow, one at a time. Today is what is back pain. So tomorrow, what causes back pain. Then we go to back pain treatment. And what can you? And the next day, what can you do for back pain at home? Then we're gonna show you some acupressure point. Then another day, we're gonna show you what exercise for back pain, right? So I believe a lot of people suffer from back pain. Now, if you suffer from back pain, please put down there and let me know you suffer from back pain. Hello from Scotland. Hi, Alison. Good morning, Alison. Karim. Good morning, Karim from Scotland. That's great. People join us, and we believe. Hi, Veronica. Veronica, good morning. Good morning. I'm good, thank you. Eric, nice to meet you. Thank you. Okay. Very exciting last night because I finally managed to do a live video that the Chinese practitioner in China that can join my live video last night. This is the first time. Every time I did every day I do live video in English in the morning, and at night time I do in Chinese language. And then what happened is we always just download whatever we have the recording, and then get my assistant to post it on the Chinese website in China, so they can watch it. But this time is different. The first time last night that we have a program, it actually allow us to pose directly do the live video, present it to the Chinese on the WeChat group and for everyone to join. So we get I think 15 people to join. Not many, but it'll build up. We have our group for about this morning when I checked, it's about 200 people join us. So tonight we will have more people join us. Okay. Good evening in Scotland. All right. We're morning. in New Zealand. Okay, now if you watching this video right now, we're gonna talk about back pain, right? We're gonna talk about back pain. If you're on Facebook or Instagram, please give me a thumbs up. I love, right? Then say hello to me. Then more importantly, because I do want to share this message to the more people, the better. Okay, so you are going to help me. You're going to help me to share this video, to share this live video. So this information need to reach more and more people. So I need you to help me to tag your friend or your practitioner, like your friend who are practitioner, or your friend or family members who are suffering from back pain. Tag them into this live video. Then, as well as share this live video as well. If you're on Facebook and Instagram, well, on the YouTube, well, the best thing you can do for me is after this, please go back to the YouTube and take the link, because always you'll be able to replay it. Take the link and post it on your social media and get people to join us. Say that you are enjoying this video every day and so informative, and suggest your friends or family to join us. Thank you very much. Then if you're watching replay on YouTube and Facebook, I'll tell you what, you can speed up, uh, uh, fast forward, we call it fast forward for this video. All right, so you can spend less time but still get the information of what I'm talking about. All right, thank you very much. And so let's start. Okay, so now I have a Buddhist monk suffer from gout on left big toes. Can I just advise him to do acupressure on the lung meridian on the thumb? Yes, you can. Veronica, very, very good question. So let's just focus on Veronica question. Okay, a Buddhist monk suffer from gout on left big toes. Okay, on the toes. Okay, over here. So on the joint, yes, you can do acupressure from over here. That is one thing. Second thing, if you want to trade quickly, on the opposite side, so level 2 and 3, was it 2 and 3? Yeah, level 2 and 3. 行间 and Tai Chong, needle 行间 and Tai Chong, but longer needles, needle those point, and deep needle, go down to that you can feel it underneath, all right? Under here, you put your hand under here, so needle it, and you feel, oh, the tip's just about coming out, and that's how deep it's going to be. And needle 行间 and Tai Chong level 2 and 3, all right, 2 and 3. Then you go to use both hands and stimulate those 2 points, like twitching, all right? Gentle, gentle, no need to be strong. Twitch the needles, then ask him to move the toes. So this, I've tried for my patient. It worked very well to reduce the swelling first. Now for gout, it's all acute issues, right? They have swelling, they have hot, and very painful, and they can't walk. Okay, after this needles, so you get them to move the toes and tap on the floor, so it can reduce it. Then you bring out the needle, bring to the superficial, not taking it out, get him to start to walk on, put pressure on. You feel immediately, in general, you feel immediately better. Dr. Jabin from Jordan, thank you for joining us. Yes, you can do on the right time on the opposite side too. Yeah, you can do the needle over here as well. So here and here, those one needle in here, one needle in here, one needle in here. So 3 needle in here to do that. Get him to do acupressure point, and that's okay too. But another result for you, sometimes if this doesn't work well, I'll go to the step strategy is use the lancet to poke in here and squeeze some blood with glasgow. Clean it quickly. Just ask mom to cough. Or probably need to get a mask when he cough, because just preventing COVID-19, right? So poke. If you have a little cupping, you can put it on the big toes and suck the blood out. It'll get rid of the inflammation, and that's important too. If you don't have it, so there's a lot of pressure and normally bleed itself, and if you can put some alcohol swab on top, it'll help it to, after poking, it'll help the blood to come up much quicker. Okay, there's another way to do that. Right, back to our topic today. Thank you for bringing out your question today. We're off topic a little bit, but don't worry, because what happened is I'm here to help you, to give you information. Thank you, Veronica, for us to have the chance to talk about how to deal with gout. So this is important too, right? This is important. Yeah. Now, what is back pain? Let's talk about back pain. Now, when we talk about back pain, I'm not just talking about the pain. I'm not just talking about the pain. I'm talking about any conditions in your back. In your back, okay? It can be tightness, it can be stiffness, it can be numbness, it can be tingling, it can be just achy, it can be sharp pain, right? It can be chronic pain, it can be acute pain. Any condition apart from pain, including pain, achy, numbness, tingling, stiffness, and tightness. That's what we're talking about. Back pain, right? Back pain, including all of this symptom. Okay, don't argue with me. Or you're just talking about pain, not about numbness, not about stiffness. And no, I'm talking about everything, all the symptoms. Okay. Now, you need to understand lower back pain. Okay, lower back pain. Now, lower back pain. When you heard about, oh, I have a back pain, I have a lower back pain. What does it tell you? It tells you this is a symptom. It's not a disease. It's not a disease. Remember? But most people say, I have a back pain, I suffer from back pain. Then majority of people think, oh, back pain, that is sick. There's a sickness. No, it's a symptom. It's not a disease. It's a symptom, okay? It's a symptom, the name of symptom, okay? Remember this. Which means this symptom, back pain, lower back pain, it can cause for many other medical disease, medical problem, medical issues. Okay, it can be several different type of medical problem that causing this, right? So let's understand what's in the back, right? This is a person who stand here. This is lower back. This is back. This is the lower back. This is upper back. This is middle back. So let's focus on the lower back then. There's a lot we can talk about. Just lower back. Just lower back. Another time we can talk about back pain and upper back. Right? Right. The structure. Now, when we talk about structure, Chinese medicine, Western medicine are both agree with those structure. Okay, there's something that Chinese medicine agree with it, but not Western medicine. Okay, and that's very funny, isn't it? Both are medicines, but both are looking the same body, but they don't agree with each other. Why is that? Because they have a different theory and different system. You know, just like I am Asian, you are European, then our culture is different, our idea is different. You know, the way that we think, the way that we look at things are different, right? Hi, IQ Gap. Nice to joining. Thank you for joining us. So this is the different, right? Let's see. What is the similar thing? Ligament, right? We all it's something that you can see in the lower back, but of course you can't see it in here, but it's in here. What can you see? You go your hand and touch it. Muscles, ligament, muscles, tendons, right? Nerve. Let's have a look. Nerve. The yellow one, that's nerve. That's nerve. Yellow one. Okay. Then what is the bony thing? They are ligament and muscle, which is not in here. We can't see it, but it's all around here, right? But what is the green one? This is the lumbar vertebrae. This is vertebrae. This is bony one. Bone. This is bone. This is bony structures that make up of the spine. So this is lumbar, thoracic, neck. Okay. So this is more now. The vertebrate body or vertebrae we call it, and in between that there's another thing called disc, and this is actually a tissue that is like a bunch, you know, soft, and the function of it is try to absorb the force, you know, in between the vertebrae. So it prevents the vertebrae contact directly and do this movement to damage itself. Okay, so it has a prevention function in here. Okay, and it helps our joint to move smoothly without pain. It helps to reduce the force between vertebrae. Okay, and this is important. This is structure. Okay, now further on, the problem of back pain, it can be from all this structure, the muscle, ligament, nerve, or vertebrae, or this problem, right? It can be from all this. Then you need to understand one thing, that if this is that way, which means I'm looking that way, right? This is my spine, right? The pokey bit is all on the back. This is the back, okay? The smooth part over here, this is the front, right? Which is the organs over here, like this person standing like this. This is how it looks, okay? This is how it looks. Yeah. Then the organs, majority organs in here can be kidneys. So kidney issues cause back pain too. Okay, that's one thing. Now, and here, I'll tell you. Yeah, the gallbladder or liver problem, you know, it can cause back pain too. It can cause back pain, right? But not necessarily lower back. It can be middle back. Okay, over here. I'll tell you what. This is all we agree with in Chinese medicine and Western medicine, but there's something that Western medicine didn't agree with that, and not to say that I shouldn't say that they didn't agree with it. They don't have any idea of it. Okay, that's in Chinese medicine. Okay, now a back pain, a symptom of back pain, it can due to stomach and spleen, and it can due to heart problem. It can due to what else? Let me think. Kidney, we know about it. Liver and gallbladder. Okay. Why is that? because we have a different thinking in here. Now, think about, we talk about ligament, right? Who control ligament? Liver and gallbladder. So we, in China, according to Chinese medicine, if and liver and gallbladder control joints. If liver and gallbladder are not strong enough, not imbalanced, then the strength of joint and ligament are weak. That cause pain. If the joint and the ligament mainly weak in the lower back, then that cause problem. Then therefore we need to bring the liver and gallbladder function up to be able to get rid of the pain. So most of the time we will see that this patient have a structural problem. Then if you ask further or you take the pulse, see the tongue, you can see, oh actually a liver and gallbladder has issue too. So you need to get rid of the pain. To relieve the pain is easy. To get rid of the pain is difficult, because if you just look at the structure, you never fix it, because they have underlying issue in the organs. Same as stomach and spleen. Stomach and spleen control muscle strength. So people say, oh, it's the tight muscle or you weak muscle, and we give you massage and do some exercise that you get better. But those acute pain quickly subside, but it turn to comes and goes, come and go, or just turn to stiffness or tightness without any pain all the time, daily, or comes and goes whenever you feel tired. Right? And then what we do? We need to check whether there is any organs imbalance. If there is organs imbalance, then we need to treat it. How do you know organ imbalance? This patient have constipation, diarrhea, stomach and spleen problem. Simple. This patient, when they feel tired, when they get diarrhea, they get back pain, stomach and spleen problem. And they have bloating, they have stomach pain, then they have, as well as they have back pain. Treat the stomach and spleen. When the stomach and spleen function better, what happened? The back condition of the stiffness, tightness, pain will subside. And you say, oh, I haven't been feeling my back pain or tightness for years now. Since my gut's better, since my bowel motion is better, since my bloating is better, you know. So that will prove that Chinese medicine treating the organs, treat the back pain. Same as a heart problem. Now, I shared with you one day previously that one of my patients have heart problem, and we take the pulse and say, this is a heart problem. But you say, well, I have back pain. Well, osteopath treated, it got better, but it didn't last. So I treat her with acupuncture, treating the local balance with the back pain. Then I put needle to help with heart. It works, but only 24 hours. Then the next time, we keep the same strategy, and for the heart, I add on moxibustions to strong the heart function. Then guess what? The result lasts for 3 or 4 days. So now we know, from this case, we know when you treat heart, it helps back pain too. Why is that? Because when the heart is stronger, it pumps more blood circulation to the back. So it helps the back heal better. That's it. So simple. Blood circulation, blood flow is the king. But blood flow is very powerful when it comes to healing your body, no matter what. Doesn't make sense to you? Judith, interesting. Good morning. Thank you. Now, does it make sense to you? Well, this theory in here, okay? I didn't make it up. This is all Chinese medicine theory. I just link it all together and explain it to you in a very simple English. So I think my English is not good, you know. I think everyone can understand it. This is how I explain to my patient. If you are practitioner and you find it very difficult to understand how Chinese medicine works, what the theory to how what would the theory link to the whole body, how would heart function better and the back pain will get better. This is my explanation because heart control blood circulation. Does it make sense to you? If it does, please comment down there and let me know. If it doesn't, that's okay. We can discuss it. Let me know down there and let me know that you don't agree with me, and that's okay. I am not trying to get everyone to agree with me. I'm not trying to get everyone to agree with me. Okay. Good morning for Jordan. Amin. It is 10:47. AQ Gap said, I enjoy your explanation. Thank you. Thank you. Thank you. We are on lockdown, so cannot go out to treat. I understand, Veronica. Yes, thank you. Right. Thank you very much for engagement, for your engagement. Thank you. Thank you. Thank you. We have Stay in Your Magic Baby. Nice to meet you and stay Instagram the others. All right. Let's keep going. Now, we talk about the Chinese medicine and Western medicine, right? The theory is a bit different. Now, the organs are the root of the entire body. That is the Chinese medicine theory. Right? Why the theory is important? If you don't have a theory, when it comes to treatment, it's totally different. What you think, whatever your theory you have, it directly impact in your treatment. Now, there are a lot of lower back pain that need to be surgery. This problem, right? According to a Western doctor, you have to get the surgeon to get operation. Then if you have the same theory of Western medicine, then your outcome and your treatment method will be the same. Will be the same. You won't have any chance to help your patient further. You won't be able to get your patient better. You won't have the same idea. Yes, you need to get surgery, right? But since you have the organ theory, then you say, no, I think we can try something else. Let's get acupuncture done. Let's get tuina. Let's get massage. Let's get Chinese herbs. They use the herbs internal use to take it or external use. Let's get some herbs for you to have shower, bath, and that helps. Okay, so also this because we have a different theory, we look different thing. We look at much bigger picture than that, right? Alicia being said, can you do a section on bell palsy soon and let me know when? This bell palsy, this is not on my plan yet because yeah, we can put it down there. It's in my notes. Yeah, if you keep following my video live, yeah, I'll do that. I'll do that. Definitely do that. But it's not in my coming up yet. Probably I can bring it further about bowel palsy. Yeah, I may be able to bring it forward, but let's just focus on my planning is my plan is going for back pain, finish the back pain. Well, this back pain is just talking about a bigger idea. It's not going to this problem how you treat it. No. It's just a general back pain. Okay, then on another day because we're gonna talk about 100 disease. I'm gonna talk 100 disease every day. Feed you a little bit of information and what I think about it in Chinese medicine and Western medicine and my experience. Okay, this is my plan, and yes, we will include bell palsy as well. Definitely will. Okay. Thank you, Alison, for asking the question. So, okay, Now, according to the American Association of Neurological Surgeons, okay, I don't have any other data. Okay, I only have the American one. Yeah, 75 to 85%. So, which is 100 people. That's 75 to 85 people. You know, will experience lower back in their life. Right, lower back pain in their life. Okay. So in the 75 to 85%, 50% of them. So 50% of those people who experience back pain in their life, 50% of them will have more than one episode within a year. So every year. So which means let's say 75 to 85, they come to about 40 to 42, 32 to 42 people. And 100 people, there are 32 to 42 people that they get back pain each year. Each year. At least once a year. At least once a year. So that's very different, isn't it? That's quite a lot, actually. No wonder that physiotherapy, chiropractor, osteopath, acupuncturist, massage therapies, we all treat back pain, and we're still in the business. There's still a lot of people come and say, "Oh, I have back pain. Oh, I have back pain and neck pain." Because a lot of people suffer from it. A lot of people suffer from it. Okay, so in 90% of all cases, the pain gets better without surgery. So without this is according to the American Association of Neurological Surgeons. Right, this is in America. But think about the 10% that require for surgery. Do they really need a surgery? Probably not. Probably not. Okay. In some cases, they do need surgery. Okay. Back pain caused by fracture. Go for surgery. I won't argue with that. I won't argue with. If back pain caused by what? Caused by lumbar disc problem. I would argue with that. No, you may not need surgery. You may just need acupuncture plus Chinese herbs. Okay, now why not just acupuncture? Why not just acupuncture? Because according to Huangdi Neijing, Chinese medicine, the very old ancient books, it says that acupuncture is great for back pain, but when the patient's organs function are weak, then don't do acupuncture, do Chinese herbs. So I just want to point out for you, if you're a patient and you look at this, watching this video, or you're a practitioner, you're watching this video, then you try to use acupuncture to treat the lumbar problem, structure problem. You may get people better, you may not. In cases that you can't help them with acupuncture, the pain keep coming back, you may get resolved, but pain keep coming back, and the patient lose a patient. You say, "Oh, why? I'll just get surgery done." That's not because of Chinese medicine can't help them. That's because acupuncture have the limitation. Acupuncture had its limitation. All right? Does that make sense to you? I didn't say that. That's Huangdi Neijing. If you're doing acupuncture, then you need to read Huangdi Neijing. Okay, Huangdi Neijing said that. That's why you need herbs. That's why you need herbs. So we are proud that we are an acupuncturist and we can treat a lot of problems, but you need to realize it, and I need to realize acupuncture can treat a lot of disease, but not for everything. Not for everything. Right? Not for everything. Because without herbs, there's not a complete Chinese medicine method. Okay, so a very complete Chinese medicine method to treat patient is including herbs and acupuncture, all right, and moxie brushing and probably Twina. But to be honest, I don't do Twina now. I used to do it when I first started business, but not anymore because it takes too much time of my time to being paid to help patient. Okay, it requires more time. Okay, so I no longer do Twina or massage. Okay, I refer to others. Hey, you can do a massage. If you want a massage Twina, go to them. All right, and cupping is good too. All right, so that's it for today, and hopefully uh, uh, you get what I need to tell you today, what I need to share you today. And if you find it helpful, please leave a comment down there and let me know how you feel for today's information. If you find it help, please give me a thumbs up. And if you find it help, please let me know down there and say, wow, Szenan, this is helpful, thank you. Or if it's not helpful, you say, I don't agree with you. That's okay too. I'm very, very open minded. Just let me know how should I improve myself next time. All right. Thank you very much and stay awesome. Thank you, Gipsy. Thank you so much for sharing your information. Thank you. Thank you. All right. Veronica said, thank you for giving us your advice and knowledge. Thank you very much. Okay. That's it for today. Stay awesome. I'm gonna end this. Thank you. Bye bye. Thank you, Karina. Thank you, Eric. Just turn it off.